proposed bill before the House of Representatives, which seeks to mandate public officials and civil servants to utilize government-owned schools and healthcare facilities, has continued to spark widespread debate across the country. The bill aims to restore public confidence in Nigeria's education and health institutions by compelling leaders to use the same services available to ordinary citizens. While some groups have publicly endorsed the move, opinions among Nigerians reveal many are in support of the bill. Our correspondent Idong Joseph is standing by live to bring us more on this matter. Idong, as always, good to have you. Can you tell us more about the proposed legislation and what may have prompted this call?
Good evening, Good. Of course, we know that the proposed legislation is to mandate public officers and even civil servants to ensure that they and their immediate family use government hospitals and even schools. We understand that from the sponsor of this bill, Oga Amobi, is born out of the fact that public officers and even civil servants detach themselves from these public institutions, contributing to the deteriorating state of this institution. And according to him, if this is allowed to scale through and become law, then it will make public officers pay more attention to this institution. Of course, we've seen cases where headmasters of government schools avoid sending their children to government schools, rather they send them to private schools. We've also seen cases where doctors working in government-owned hospitals do not seek services from these hospitals, rather use the private hospitals. We've also seen in several cases where politicians, elected officers, fly out of the country just to get medical treatment for even a common ailment that can be treated in Nigeria. And according to the sponsor, if this is allowed to scale through and it becomes law, then we'll start seeing a change in our educational and health institutions. So that's the essence of the bill, and that's what it intends to bring, to restore the accountability of public institutions.
It makes, I mean, this has been an argument that has been at the fore amongst many Nigerians for decades, and now seeing it come on as a debate on the floor is very interesting. I wonder what you think your reactions with Nigerians on the streets have been. What is their position on the proposed bill? I'm guessing affirmative.
Well, this proposed legislation has received widespread reactions, and we've spoken to Nigerians on camera and off camera, and so many of them are showing their support in regards to this bill. But however, there are concerns, and some of those concerns are they fear that this bill, once it is being brought again to the House for debate, most lawmakers are not going to support it. That is the major concerns of many Nigerians, but they see it as one piece of legislation that, if allowed to become law, then that glory of our public institutions like the healthcare facilities and educational facilities, which are now being left to the common Nigerian, the everyday Nigerians to seek service from, will be improved and it will be restored. So Nigerians are very happy with, they are welcoming this bill, but the concerns still remain that it might not scale through to become law.
And those are very huge concerns as well, because even if it scales through, another question that needs to be brought to the fore is about implementation and monitoring, and whether or not the individuals or the civil service members will follow through on that law. But I must say thank you, Idong, for taking out the time to join us. Idong Joseph there, our correspondent live from Abuja, giving us a bit of insight following a bill that's moved in the House regarding civil servants and politicians sending their children, or better yet, patronizing public services.